This is Dr. Arlen Meyers. I'm President and CEO of the Society of Physician Entrepreneurs. So who are the early evangelists in healthcare? Steve Blank has popularized the term early evangelists in his lean startup books and describes them as the innovative customers who are willing to take a leap of faith in a startup product. He, in addition, claims that the lean startup methodologies are indeed applicable to pharma, medical device, and particularly digital health, but I disagree because the uniqueness of the U.S. healthcare system with third-party intermediaries as being the payer begs the question, who is really the early evangelist? Is it the patient who the doctor uses the device or drug on? Is it the doctor who is in fact the user? Is it the customer, which in many instances is neither the doctor nor the patient, but instead a hospital buying equipment or drugs to be used by technicians or people who work in the organization? And finally, there are the payers who are reimbursing the customers and in some instances the users for the technology that's being used. So the fact that there are third-party payers and intermediaries muddies the water and makes it difficult to decide who in fact is really the early evangelist. In my opinion, all four are the early evangelists, which makes patient development or customer development so difficult and almost impossible to predict. Given that, I feel that the future of medtech development and biopharma development will depend, and digital health development will depend on satisfying the interests of all four. That is, patients, users, customers, and payers. After all, there are multiple stakeholders and multiple people that have to see value in whatever it is you're offering. This is Dr. Arlen Meyers. I'm with the Society of Physician Entrepreneurs at www.soapnet.org.